Good morning to everyone in Indonesia and Singapore and the rest of our friends from all around the world. Thank you for the opportunity to give my lecture on AI and robotic assisted hand surgery, pioneering precision in orthopedic procedures. I'm currently in Beijing right now and attending another conference, so I thought it would be a good idea to record my lecture beforehand. So the contents of my talk, first I'd like to share with you my own personal journey in trying to understand the differences between robots and AI, their current applications in the field of hand and reconstructive microsurgery, and also touch a little bit about potential future developments in our subspecialty as well. So what is the difference between robots and AI? So my readings for the evolution of robots brought me back more than 2,000 years ago, all the way to the Greek civilization. Robots then were known as automata, the first concept of mechanics and pneumatics. Hero of Alexandria was a person who kept coming up during my readings. He was a very prominent Greek mathematician who existed sometime in 1st century AD, and he had important inventions such as the aeoliphae, which laid the foundation for the steam engine, which many of us know that is a remarkably important invention, especially during the Industrial Revolution. So this actually makes use of fire that heats up a metal pot that conducts heat, giving rise to steam that turns this turbine at the top. So yeah, he's really important. Later on, because faith was a very important part of Greek civilization, he actually made temples appear to have self-opening doors, such that it appeared to be a magical divine act to inspire faith in people. So he was really quite the Tony Stark of his time. So later on, as automata developed, they were actually primarily used for entertainment and were powered by steam and/or gears. So this is a karakuri puppet, primarily just using gears to actually entertain people. You can see that very ingenious. So as robots develop and evolve during especially the Industrial Revolution, where there was a global transition of the human economy from agrarian agriculture to industrial civilization. So then during this time, more inventions came up with practical applications. They were automated with remote control, they were wireless, all for the sake of economic progression. So when did this name robot came about? The origin of the present-day robot actually was first used by a Czech playwright called Karel Čapek in his play Rossum's Universal Robots. This play was actually the product of a Central European system of serfdom, where the tenants actually paid their rent with forced labor. But at the end of the day, the word robot was actually to serve humanity. And this is the case even so today. As we move from a 5G to a 6G world, these are the arenas that will encompass more and more of our lives. Certainly, robotic surgery is one such area. Already in the world of robots, some examples. I'm sure many of you in the audience are familiar with the Da Vinci robot for general surgery. And I'd like to speak about computer-navigated orthopedic surgery, where we integrate CT into navigation-based surgery. So this was pioneered in France in the Université Grenoble in the Alps. It was breakthrough research during that time. Spine and pelvis were the first to come on board in about 1997, followed by prosthetic knee surgery, which is certainly probably the one that is most commonly done now. Hip and shoulder were next in the game. And lastly, hand surgery was the newest kid on the block. Only in 2016 did Tinavi, which is a Chinese commercial robot, started to do robotic surgery in hands. So the current application of robotics specifically for hand surgery, I'd like to invite you to read this article in the Journal of Hand Surgery that was just published this year in June 2025. This article has many issues on innovations and emerging trends in hand surgery. So I'm very happy to be able to co-author this paper with my friends from China and France on the current insights and future directions in this area. There's also an atlas that is recently hot off the press just last month in September 2025. So this is the first comprehensive atlas of robotic assisted procedures in plastic and reconstructive surgery. And it offers step-by-step procedures with accompanying photographs and a complete video for each chapter. So I'm also very happy to co-author the chapter on wrist surgery with my mentor, Professor Leopold. Why are we the latest kid on the block? I think it's because for hand surgery, it's a very unique specialty. It has both bone and soft tissue work. It has very tiny, but very complex anatomy. So this is not simply just about downsizing the robot. There's a need for precision with a very small margin of error. So currently there are two main robots, one for soft tissue, the Simani, and for bony work, we have the Tinabi machine, which I'll speak a bit more now. So this is actually the manual anastomosis, and as you can see, is very shaky, something that's very familiar to many of us, especially when we were first starting out, as compared to the robotic anastomosis, which is very stable. There's a reduction of the tremors and motion skilling. So this is the difference that you can see from these videos as I show them to you now. And then I'm going to move on to show you the Chinese robot.
3右侧螺钉。
there is a customization to hand surgery required for the robots used in this field. The software reprogramming for specific anatomy, and also you will need specific instruments for positioning of the limb, as well as sizable trackers. I've come up with a few slides to speak about 6 steps for using the T-robot in bone work for robotic assisted hand surgery. So first you have the pre-op imaging and planning that is done outside of the operating theater. You have to do that and assemble your team. The next will be the preparation for the robot. So currently we use this 3D fluoroscopy unit from Germany. There's a navigation system that is invented by Tenavi, and there's an optical tracking system that is made up of an infrared stereo camera, robotic reference frame, patient reference frame, and then as well as the robotic arm that we use to fire the K-wires. So the T-robot system is a stereotactic robotic arm with 6 degrees of freedom. As you can see, the patient's hand is actually strapped onto this 3D printed jig to position the limb in place, and the trackers are there to pick up, and this is how the setup is done. So the infrared stereo camera is the one with the optical tracking eyes, is the one that captures the images, and the intra-op CT is done in the operating theater. So the images are then divided into the axial, sagittal, as well as the coronal planes in real time, up to accuracy of 1 millimeters. As you can see, the screw position is checked in all 3 planes as well in real time. The execution of the robot, once you are happy with how the implant is in place, you click on a button and the robot is in place, goes into position for that. And then we put in the robot assisted screws. Moving on to learning curves for robotic versus freehand surgery. So there are 2 papers currently that we have in 2023 and 2024 on 1 center and 2 centers respectively. The key points to take home from this is that robotic assisted techniques show promising results. A single guide wire attempt with lower amounts of radiation, minimizing the technical expertise required. Both groups, there's satisfactory screw placement, but close supervision is still advised for the first 20 cases. What exactly is AI? AI is actually an umbrella term for machine simulation of the human cognition. In other words, you're trying to make a machine think like a human. It is made up of complex algorithms for intelligent data storage and processing into functional tools that we can use in everyday life. It has very strong foundation in mathematics, statistics, and programming, for which in our background as clinicians, we are not particularly good at. So we need to put in a lot of effort in order to understand AI. This is a human neuron versus an artificial neuron. As you can see, they are both similar in a way that you have multiple dendrites that make up for the multiple inputs, a processing unit that is the nucleus, and you actually have a single output after you have processed all the data that you have collected into this storage system. The evolution of AI. So for Alan Turing, he is actually the godfather of AI in my opinion. As you have known, many of you in the audience have heard about this famous movie called Imitation Game. It is one of my personal favorites. So for those who are not familiar, Alan Turing actually invented the first computer that broke the Enigma machine that was used by Nazi Germany during the World War. And because of him using this computer to break the Enigma code, he potentially saved millions of lives and shortened the World War by 2.5 years. Then there's a maturation phase in 1957 to 1979, where the American Association of AI was actually founded. There was a boom in the 1980s to 1987 where the first AAAI conference was held at Stanford, and Japan actually had their 5th generation computer project. The AI agents came into play in the 1990s to 2010s, where you are very familiar with Twitter, Facebook, Netflix algorithms. And currently bringing us to the present, we have Sophia, who is actually the first robot in the world to actually have Saudi citizenship, and the ubiquitous ChatGPT. So, what are the current applications for AI in hand surgery? There are 4 pillars of AI in hand surgery, made up of natural language processing, of which the most work has been done, computer vision, machine learning, as well as what has been touched on earlier, robotics. AI medical applications, users in patient care, education and research are all going on at the same time now, but adoption into clinical practice is still in its very early phases. These are some of the AI users in patient care in diagnostic. So this is a paper on the diagnostic performance of AI for detection of scaphoid and distal radius fractures. It's a meta-analysis identifying 21 studies, 12 distal radiuses and 9 scaphoids. They demonstrated excellent performance, with the AI machine able to demonstrate comparable or better performance compared with human experts, with worse performance on occult fractures, which is quite the same as humans. But the background and experience of the human expert and type of fracture on which the model is trained are very important factors. This is a paper on the diagnostic as well, on AI-powered advancement in upper limb joint MRI. Is a review article. The current uses for AI in MRI imaging is to reduce the image acquisition time and to improve the image quality. And there's also developments in the deep learning arena so that we can assist in diagnosis as well as overall to reduce medical costs. There is also another paper that I have on post-operative care, this deep learning and remote photoplasmography powered advancement in contactless physiological measurement. So what is contactless measurements is where you use skin perfusion, respiratory rate, SpO2, heart rate or blood pressure. And we actually develop computer vision or deep learning to do this remote image photoplasmography to allow prediction of vital signs using image or videos. However, there are still limitations because there's heterogeneity in video signals because of movement, lighting, and equipment. But we are slowly but surely getting there. I have an artificial intelligence model paper on vascularity monitoring of post-operative flap. So for all of those in the audience who are familiar with flaps, post-operative flap monitoring is very labor intensive. There's a lot of subjective judgment on skin color. So for this paper that is published recently in the Journal of Craniofacial Surgery, we simulated clinical situation of vascular compromise in an upper limb, and we used an AI model with skin color monitoring algorithms and pulse wave monitoring algorithms to identify vascularity changes. So we simulated like arterial obstruction, venous obstruction, and we compared it with manual assessment and contact-based devices. It shows promising preliminary results, and I invite you to read the paper if you are interested. In terms of consultative assistance, ChatGPT is certainly being used in the current field as an assistive tool. It cannot take over clinician at this point yet. They have an average score of about 4.6, reflecting good performance in documenting a medical history as evaluated by hand surgeons. So this is something that we can look at and will definitely be a point that will keep evolving in the time to come. For AI users in patient care, hand surgery, rehabilitation-wise, I can share with you some of my work I've done on a 3D robotic thumb. So we use this servo, motor, and flexi sensor to actually create this movement when we strap it onto a thumb. I'm not able to go into further details because of time, but this is one area that I am working on. So in terms of medical education, you can actually assess suturing techniques using virtual reality surgical simulator. So over here, you actually have a screen that's projected on this glass so that there's a virtual environment that mimics natural hand-eye coordination. The person is wearing stereo glasses to be able to visualize the images, and it allows for depth penetration. So then we'll use these markers to actually do suturing. So there are 5 different shapes of needles used in this study. And the video screen of the model actually captures through this, and we monitor the parameters for like time taken, motion smoothness, tissue tear size, penetration and exit angles, and the tool motion to evaluate students who are keen to practice microsurgery. In other areas as well, VR is like used as parent education tools for example, in cleft lip surgery, and also to calm children down in pediatric patients that are undergoing general anesthesia. So these are areas that is happening in other fields of medicine, which I think will definitely be the norm in the time to come. So can large language models extract structured data from free text clinical documents? That is certainly the case in most of hospitals now. I think for research, it is possible, but it's not perfect. There's a lot of spelling errors, messy documentation. It's not ready to replace manual data extraction. We need to clean up raw data. We need more data and more fine-tuning. So it is still in the works, but not able to be used as of yet. So what does the future hold for us? So predictive AI for Singapore healthcare, this was the article in the Straits Times that came out recently. It is a cornerstone of my country's national strategy, for example, in precision medicine for targeted cancer treatment, forecasting disease risk years in advance, called the personalized era of medicine. We also can teach the next generation of clinicians to wield powerful tools, such as the diagnostic co-pilot for the CAS-MI in SGH, and also to actually make sense of data tsunamis to targeted therapies, such as in the National Heart Center in Singapore for rapid coronary artery disease detection. And actually, at the cornerstone of it all, we want to advance human touch, because AI allows us to create space and time for humans to be humans. We will have more time to connect with our patients, show empathy, but at the same time be supported by all these technologies that AI can otherwise offer to us. I think here it is important for all of us to think about model transparency. Before you use an AI model to do clinical work or in whichever, I think it is important to explain. You are able to explain how and why an AI model produces an outcome. It is important for clinicians to make informed decisions, explain how the decision is made to patients. There are currently no automated AI decision-making system in healthcare as yet, but they are on the brink and likely to be in place in the future. My final thoughts are, predictive repetitive jobs are most at risk of being replaced by robots. You have to essential to keep upgrading your skills. And the government and society have a pivotal role in securing equal economic opportunities for everyone. I think that at the end of the day, it is inevitable that we work hand in hand. It is not why, but when. Thank you for your time and interest. Please feel free to email me, or you can DM me in my Instagram handle. Thank you.